Today I'll be covering Mercury Medical's NIFometer. A NIFometer, or NIF for short, is the device that measures negative inspiratory force, or what is sometimes referred to as a MIP, or maximum inspiratory pressure. A NIF test is used to determine a patient's respiratory muscle strength by measuring how much negative pressure or effort they can create when they inhale. There are two main reasons to do a NIF. First, a NIF is part of the process to determine if a patient is ready to be removed or weaned from a ventilator. A NIF test is part of a spontaneous breathing trial, or you might hear the term SBT. An SBT is attempted when the patient is getting better. Arterial blood gases or ABG values are acceptable. The patient is stable and not on any medication that depresses breathing. In most cases, a NIF of negative 30 centimeters of water is needed to successfully be removed from a ventilator. If the patient passes the SBT, the patient can be placed on a T-piece or a different mode on a ventilator that allows the patient to do more of the work. Some ventilators have options to do a NIF test through the ventilator. However, in most cases, a separate device is used. A NIFometer is also used to treat disease progression for diseases such as Guillain-Barré syndrome or myasthenia gravis. If the NIF drops below or near negative 20 centimeters of water, indicating increased muscle weakness, the patient will often need additional respiratory support. A bilevel device is often used for patients with a NIF between negative 20 and negative 30 centimeters of water. Mercury Medical's NIFometer is a disposable single-piece use device, lightweight and easy to use. It's a non-disposable device, must be brought from room to room, possibly spreading infections are often lost. Mercury's NIFometer can come with either a 0 to 40 or 0 to 60 manometer and can be purchased as a kit that includes a mouthpiece, elbow, and nose clips. The NIFometer is a pretty simple device. The manometer has two arrows, one black and one orange that you'd be able to see on the manometer. When the patient inhales, the black needle will go around, taking the orange needle with it. When the person stops inhaling, the black needle will go back to the 6 o'clock position. The orange needle will stay where the patient had most achieved, or the most negative pressure that they were able to achieve. To reset it, there's a turn knob on the center of the manometer and you can return it back to 0. Now it's important to realize that during a NIF test the patient can't breathe. Now just below the manometer there is actually a push button here. So you would take it, and if the patient is doing it on a mouthpiece, you would instruct them to take breaths through it. And when they're ready, the clinician basically depresses the button. They inhale, now they can't take any air in, and it will measure on the manometer to see how much effort or how much negative pressure that they can draw in. So just remember, again, the patient can't breathe when you're doing this, so you have them a chance to do that. Now this can also be used without the mouthpiece, where you can actually put it on an endotracheal tube, can be put on a trach tube. Now when a patient does this, sometime if they're doing it spontaneously, you can use a nose clip. Nose clip a lot of times helps them get a little bit better reading, so it's an optional to be able to do that. But when patients are instructed to do this, it's not like they're drawing on a straw, that they're using all the muscles in their mouth and their lips and stuff to do that. We really want to measure their ability to use their chest muscles and their diaphragm, the respiratory mechanics and muscles to do that. So the patient really needs to be able to do that using those respiratory muscles and not their lips. So following this video, there's going to be a short video giving a demonstration on how to do it on a ventilated patient. Thank you.
Okay. So we'll instruct our patient here. Again, Mr. Dunphy, we're going to again measure how strong your breathing muscles are with this test. You know, the previous test we did with the deep breath and everything was seeing how deep a breath you could take. You're going to do the test very similar to the way we did that. So whenever I'm going to put this device on the end of your tube, and when I tell you to, I want you to take in a good deep breath, except with this device it's going to feel like you can't get any air in. but that's only going to last for a very short period of time, okay? We're just trying to measure how strong your breathing muscles are so that we can see if it's time to get you off the machine, okay? All right, so first thing I'm going to do before I disconnect him and have him do this test is I'm going to silence my alarms, because I'm sure this ventilator is going to want to go off. All right, we're going to take you off here, Mr. Dunphy. Make sure that this is put someplace where it's not going to get contaminated. We attach the device to the end of the tube here, and we've reset the marker here at 0. And just want you to relax and breathe normal, kind of get used to it, okay? I'm watching his chest as he inhales and exhales. And whenever I see him exhale, the next time I'm going to include it, take a deep breath in, pull hard, okay? Good. You can see that it pegged way over here where the little orange level is. Just relax and breathe normal, Mr. Dunphy. I'm going to reset it. And we'll have him do it one more time just to see how he does. Okay, I'm watching him breathe. Okay, take a deep breath in, Mr. Dunphy. Pull hard. Pull hard. Pull. Good. All right, and that was a 30. So now, actually, that's about a 32. We'll put him back on the ventilator. Okay, how you feeling? Pretty good? All right.